Cancer is a group of diseases involving abnormal cell growth with the potential to invade or spread to other parts of the body. These contrast with benign tumors, which do not spread. Possible signs and symptoms include a lump, abnormal bleeding, prolonged cough, unexplained weight loss, and a change in bowel movements. Metastasis is the spread of cancer to other locations in the body. Common sites and symptoms of cancer metastasis. In brain, headaches, seizures, vertigo. In respiratory, cough, hemoptysis, dyspnea, lymph nodes, lymphadenopathy. In liver, hepatomegaly, jaundice. In skeletal, pain, fractures, spinal cord compression. Causes of cancer. The majority of cancers, some 90 to 95% of cases, are due to genetic mutations from environmental and lifestyle factors. The remaining 5 to 10% are due to inherited genetics. Environmental refers to any cause that is not inherited, such as lifestyle, economic, and behavioral factors, and not merely pollution. Common environmental factors that contribute to cancer death include tobacco use, 25 to 30%, diet and obesity, 30 to 35%, infections, 15 to 20%, radiation, both ionizing and non-ionizing, up to 10%, lack of physical activity, and pollution. Classification. From a histological standpoint, there are hundreds of different cancers, which are grouped into 6 major categories. They are carcinoma, sarcoma, myeloma, leukemia, lymphoma. Mixed types. Carcinoma. 1. Carcinoma refers to a malignant neoplasm of epithelial origin or cancer of the internal or external lining of the body. Carcinomas, malignancies of epithelial tissue, account for 80 to 90% of all cancer cases. 2. Sarcoma refers to cancer that originates in supportive and connective tissues such as bones, tendons, cartilage, muscle, and fat. Generally occurring in young adults, the most common sarcoma often develops as a painful mass on the bone. Sarcoma tumors usually resemble the tissue in which they grow. 3. Myeloma. Myeloma is cancer that originates in the plasma cells of bone marrow. The plasma cells produce some of the proteins found in blood. 4. Leukemias, liquid cancers, or blood cancers, are cancers of the bone marrow, the site of blood cell production. The word leukemia means white blood in Greek. The disease is often associated with the overproduction of immature white blood cells. 5. Lymphoma. Lymphomas develop in the glands or nodes of the lymphatic system, a network of vessels, nodes, and organs, specifically the spleen, tonsils, and thymus, that purify bodily fluids and produce infection-fighting white blood cells, or lymphocytes. The lymphomas are subclassified into 2 categories, Hodgkin lymphoma and non-Hodgkin lymphoma. The presence of Reed-Sternberg cells in Hodgkin lymphoma diagnostically distinguishes Hodgkin lymphoma from non-Hodgkin lymphoma. 6. The type components may be within one category or from different categories. Some examples are adenosquamous carcinoma, mixed mesodermal tumor, carcinosarcoma, teratocarcinoma. Diagnosis of cancer, based on a person's symptoms, the results of a physical examination, and also include imaging, laboratory tests, including tests for tumor markers, tumor biopsy, endoscopic examination, surgery, or genetic testing. Prevention of cancer. Cancer prevention is defined as active measures to decrease cancer risk. The vast majority of cancer cases are due to environmental risk factors. Many of these environmental factors are controllable lifestyle choices. Thus, cancer is generally preventable. Between 70% and 90% of common cancers are due to environmental factors and therefore potentially preventable. But, not all environmental causes are controllable, such as naturally occurring background radiation and cancers caused through hereditary genetic disorders and thus are not preventable. Dietary recommendations for cancer prevention typically include an emphasis on vegetables, fruit, whole grains and fish and an avoidance of processed and red meat, beef, pork, lamb, animal fats, pickled foods and refined carbohydrates. There are many types of cancer treatment. Some people with cancer have only one treatment, but most people have a combination of treatments, such as surgery with chemotherapy and radiation therapy. Other options include targeted therapy, immunotherapy, laser, hormonal therapy, and others.